This is Dr. Palacios, and I'm here to talk to you about heart disease, part 4 of 5. In this case, allopathic treatments. So this is just a quick guide as to what your medical conventional doctor may do if he realizes or you have been diagnosed with heart disease. Again, the information that I'm providing here is only for educational purposes, and it's not supposed to replace, treat, or diagnose any medical conditions. And if it's something that you notice that if you have heart disease and it's something you want to apply, make sure that you consult your healthcare provider. Okay, so without saying much, let's get started. So for this part, I'm just gonna talk about 3 treatments because for heart disease, it can be a wide array of medications. There's a lot of drugs out there that can help for heart disease. It all depends on the specific diagnosis, like is it for high blood pressure, is it for kidney failure, is it for clots. So in this case, I'm going to talk about 2 very common medications, and then a lifestyle change that your doctor may recommend. So the first one is something called nitric oxide, or it's called under the category of nitrates. So what nitrates do is they, it's like a little tablet. You take it, sometimes you can dissolve it under the tongue, and it goes into your system that way. And it's about 1 to 2 minutes. Really, it works very fast. And what it does, it goes into the vessels of the heart. And you may be having chest pain, and then that little vessel can expand and allow the blood flow to increase in these heart vessels. So that way your heart can go back to normal, receive the amount of oxygen that it needs. Because again, if you have chest pain, especially the one where you're, it may be heart related chest pain, it means that your heart is not getting enough oxygen in the first place. And that could be from many reasons. So that's the first one. That's the mechanism of action. That's how it works. Side effects, besides general tiredness, sometimes dizziness, some people experience migraine-like headaches. So again, be careful with that medication. If you experience some type of migraines from that, make sure to talk to your doctor for any other alternatives. The next one is the statin drugs. So atorvastatin, simvastatin, pravastatin. There's a whole family with the ending of the word statin. And how they work is they work specifically on an enzyme that blocks the pathway of fat becoming into cholesterol, because cholesterol is a type of fat. It's more of a hormonal kind of fat, because the cholesterol can be used to create hormones too. But before that, it goes through a whole series of chemical reactions, and the statins help prevent the formation of cholesterol. So when you take it, your cholesterol levels are gonna end up reducing, and that includes your LDL, also your HDL, which is not necessarily a good thing either. I mean, the LDL is good, but the HDL is not something that you want to be reducing as much. Another thing, however, that it also reduces is the production of a chemical called CoQ10. Another word is ubiquinone, if it's the oxidized agent, the oxidized form. And then the reduced form is called ubiquinol, which is a little bit more active. So again, quick CoQ10, it's very essential for mitochondrial health, which means the powerhouse of energy of the muscle cells, well, actually for any cells in general, but the ones that use, ATPs and energy at the most is the skeletal muscle, because every movement that you make, some sort of energy is being used. So when CoQ10 is getting blocked, the levels of energy muscles being created is going to decrease, and that can lead to something called rhabdomyolysis, which is a very rare but also serious side effect of statins. And that can generally give you pain, especially muscle soreness, and you notice that you get tired more easily, you get more fatigue, and that's usually because there's some sort of muscular destruction going on in your body. So again, if that's the case, make sure you consult your doctor. You're more than welcome to try to take CoQ10, which will be something needed because that's getting depleted if you take statins. Okay, and the last one is more of a lifestyle change that your doctor may say, and it's to eat more fruits and vegetables. In this case, you know, you gotta start reducing your lifestyles, foods, you know, like the comfort foods, like the high fats, excess alcohol, probably smoking, you know, stop smoking as well. Remove refined sugars and refined carbs and use more like wholesome carbohydrates, more fibers may be added, and then vegetables in general because they have so many antioxidants and they also help to clean the blood with the clots. Okay, so those are 3 things that your allopathic medical doctor may do if in case you have heart disease. And again, it all depends on the types of symptoms and the diagnosis that you've been given from the, you know, the big umbrella of heart disease. If you have any questions, please feel free to put them down, write them down. I'll be happy to answer them. And I think that's it. So thank you so much for listening, and I hope you learned something new from here. And I'll see you next time on the last video, which is naturopathic treatment of heart disease. Thank you so much.